Hello there once again. If you're just tuning in, you're watching Hala Kuwait right here on KTV2, the family channel. And we're moving on now to our second interview segment that we have for you this evening. We have with us right here in the studio, we have with us Ali Alhendal, and Ali is the Assistant General Manager at Life and Health Division of Gulf Insurance Group. Ali, welcome to our program, Hala Kuwait.
Thank you for having me in this program. It's my pleasure.
Nice to have you with us right here on the show. And there's a new, I believe, health insurance policy out for Kuwaiti citizens. I believe it's called Afya.
Afya.
So tell us a little bit, what is this about and so forth, please?
Afya, it's an implementation for the law number 114 for the year 2014. It is a health insurance. It's a law which is a grant the Kuwaiti retirees who are registered under the Public Institution of Social Security, a complementary health insurance coverage. So according to this coverage, they will have an access to the private medical sector of healthcare sector. And still, all the retirees, they will still have an access to the public sector, similar to any other segment of the population. The inception date of this scheme started last Sunday. So
it's about a week now that's been active.
Exactly. It's active since week.
And so do people, Ali, now watching now, and they go pick up their insurance cards, or what's the process? How do they get their cards? Or tell us about that, please.
Actually, we start distributing the card in around 47 distribution points around Kuwait. It is 33 clinic from the public clinics, and 14 branches of our branches as a Gulf Insurance Group. It is within a minute. The retired people, they can go there to any distribution point, just to show their
civil ID.
Exactly, to show their civil ID and to get their the insurance card.
Okay.
Yeah.
And this is for all retirees. Doesn't matter what age you are or anything.
Yes, it is.
You've worked and you retired. Even some people retire much younger than others. They're entitled to?
Exactly, yes. There is no age limit. The only condition is to be registered and then under the Social Security.
Okay.
Yes.
And Ali, now what does this health insurance policy cover? Does it cover a lot of things?
Yeah.
Tell us about the coverage, please.
It is cover the inpatient up to 10,000 KD. It's also cover the outpatient and the chronic treatment up to 4,000 KD. In addition to that, it's covered dental. We have a limit of 1,500. It's cover pregnancy and maternity up to 1,500. This is the major coverage. In addition to that, what makes this insurance scheme special is the waiver of pre-existing condition. That's mean all the population, they still can have the treatment for any pre-existing case. That's why from the day one we have delivery cases, we have surgeries from day one of the
Okay, great. Well, we have a lot more to talk about, Ali, but we have this report that we'd like to take a look at dealing with our subject, and then we'll be back with you to continue our interview. Stay tuned.
This is the first launching of the first Afya cards for those who are retired, more than 117,000 Kuwaitis, male and female, retired from their work. They are entitled to have a coverage. This coverage is a medical insurance that will cover not only I would say the vast majority of the common diseases and problems, medical problems. different branches of medicine are covered. Up to 1,000 KD will cover the admission, the major operations, orthopedic surgery, endoscopes, ENT, ophthalmology, all these will be covered. 4,000 will cover the outpatient clinics. So this is again covered. Also the emergency, if any of them feel that he needs immediate kind of a problem, immediate attention, they can go for the emergency divisions and they will have immediate care for that. Also there will be obs and gynae, we call it in medicine, for the ladies if they have any problem, or deliveries, or different kind of problems, they are entitled to be covered. Also there is one aspect of the dental care, so that's really a package. What's not included in this package is, for example, cosmetic surgery, AIDS, infectious disease, cancer, delicate, complicated surgery is not covered. But all in all, the vast majority of the signs, symptoms, and problems are covered with that. Those who are, by definition are retired Kuwaitis, they can collect their Afya cards from a list of more than 45 centers all over Kuwait in different governorate. They can have their cards. The package of clinics, medical centers, hospitals, pharmacists, and also labs, both the X-ray centers as well as the labs, they are listed in a long list, covers around 100 titles, and they will be covered in the brochure that usually they will be handed over with the card as well. Well, this is projects. It means the peak of cooperation between the parliamentarian as well as the government. It's part of the Sustainable Development Plan in Kuwait. It's a chance. It's free of any charge. It does not deny those who have the card from going back for the medical centers or hospitals, and they are entitled to have a good care. We in the Ministry of Health will not compromise on the quality of care and safety of the patient, as well as the professional conduct. This is a must, and we'll have hotline that people can communicate to maximize their utilization of the service, and to put any remarks for improvement or personal experience with that.
The purpose of this insurance is to add value, an additional benefit for the retirees of the Kuwaiti national to be treated in the private sector in addition to the public sector.
Well, we're back right here on the program, and our guest, continuing with our guest, Alhendal, who is the Assistant General Manager of the Life and Health Division at Gulf Insurance Group. And Ali, maybe you could tell us a little bit about the mechanism now of this insurance policy, please.
The mechanism is very simple to get the service of the insurance coverage. Actually, we have a very sophisticated system which is directly linked with all medical providers. We have around 120 medical providers and more than 1,000 physicians and consultants. All the eligible people, they can go to any of our medical providers. They just have to show both the civil ID and the insurance card. And the receptionist there at any medical center, they will take care about the rest of the other formalities and other things. It's very simple, and usually we have a very limited time frame and our turnaround time to finish the data entry and
this is a normal like registration process at any hospital when you go to see a doctor.
Exactly,
and so
and usually we require a pre-authorization, which is also a responsibility for the medical providers for very limited time of service, such as inpatient, MRI, day case surgeries. And usually we have a maximum time for this pre-approval around 30 minutes a maximum.
Okay, great to hear that.
Yes.
And now for people who haven't picked up their insurance cards, you said there were 33 different locations, also the company and so forth. So can they just go to like their polyclinic in their area and do that? Is that the easiest way?
To get the card?
Yeah.
Actually, to get the card, yes, we have 47 center distribution points.
Sorry, yeah.
In addition to that, in case someone go and visit the medical provider without the insurance card, they still can have the access to their insurance coverage by only presenting the civil ID.
Okay, great to hear about that. And then, how do you, plan to stop the misuse of sometimes, it's always insurance policies, there's always people that commit fraud and there's misuse of the policy. How do you guys going to stop some of that?
Number one, we as insurance company, we are specialized in risk management, definitely, and this is one of the risk, managing such a big scheme like retirees or like Afya scheme. Actually, we have, number one, we have many specialized team. We have more than 50 specialized physician and paramedical team in order to audit all the claims. So usually after we receive all the physical claims, we used to audit all of them, medical audit, technical audits. In addition to that, the policy itself or the Afya program is limited to specific number of providers within the network. And usually we have a special contract with a medical provider which allow us to do and perform the auditing. In addition to that, we have a very sophisticated system for data mining, business intelligence system, which is allow us to analyze any abnormal trend, to take an immediate action for that. So we immediately detect any fraud or misuse, and usually we have a contractual agreement for interference, which allow us to interfere in such cases.
And Ali, on the other hand, there's always the user also has complaints and so forth. They're not happy with things and so forth. So what are you going to do to help that, to help the retirees benefit from this with the less amount of complaints?
Actually, we and the GIG and Ministry of Health, they work together to design and implement many different access for the complaints. Number one, we have a 24-hour call center, so all the insured members, they can easily call and raise their complaints. Any complaint will be registered in a system which is for follow-up and for tracking the complaints. In addition to that, we have delegates in hospitals. So, and soon we will have booth within the major medical providers. So all insured members, they can go directly to these delegates and raise their complaints, and it will be registered. Very soon, within maybe 2 or 3 weeks, we will both together, GIG and Ministry of Health, we will announce for a website and mobile application. So you don't even have to physically go and raise your complaint.
Simpler.
Yes, you can make, yes, exactly. You can put your complaint within or inquiry using the website and mobile application.
So what makes this Afya health insurance policy, this package special, Ali?
Number one, the size. Comparing to the Kuwaiti market, it is very huge scheme. We are talking about 18,000 members. The other thing, it's come by law, by legislation, and it is a complementary scheme. We believe at GIG this is a good start for the future. We believe that at a point of time, the health insurance will be implemented to all population. So this is what make Afya program a special program.
Well, do you have any last comments or words at the end of our interview this evening, Ali?
My last comment, I wish best of health for all retired people within this insurance policy, and we thank you for having us today.
Pleasure of having you right here
Thank
on the
you.
program, and we'd like to thank you, Ali Alhendal.